Hi everyone, I am Dr. Vaishali Sharma, consultant gynecologist, laparoscopic surgeon and infertility specialist. Today we are going to discuss about side effects of IVF injections commonly taken during any IVF cycle. Nowadays IVF cycles have increased a lot in number. We are getting many patients of infertility who have to undergo an IVF cycle to achieve a pregnancy. And the total number of injections which are given in an IVF cycle, they varies from the procedure which is going on actually. When the egg retrieval part is going on, in that scenario, the lady has to undergo an injections and stimulation process where she has to take almost daily 1 or 2 injections or maybe 3 injections per day, depending upon which protocol she has been recruited to. So if we talk about what kind of injections are these and what can be the side effects, these injections are actually the same hormones which are present in everybody's body, and we are just giving them so that the total number of eggs which we can take out from the ovaries are more in number. As such, the number of injections and the dosage of the injection, it depends upon the age of the lady, and we are giving the same hormones which are actually present in your body in a slightly higher amount so that the number of eggs that we can retrieve from your ovaries are on higher side. Because as we all know, the hormones which are present in our body, they lead to formation of 1 egg in 1 month. But what we are trying here, we are trying to get at least 10 or 15 eggs in that cycle so that we are able to make a good number of embryos from that IVF cycle. So the injections which we are basically giving to you are the hormones which are actually present in your body, but we are giving to you in a slightly higher dose. So the symptoms that you can have or the side effects which can be there because of these injections are actually the same which you usually feel whenever you are undergoing any premenstrual symptom, or like you may have too much of mood swings because of such a high dose of hormones, and you may have too much of tenderness or bloating, or you may have too much of nausea or vomiting. Some people, they may have breast tenderness. So there are these generalized symptoms which can be there because of these hormones which are used in IVF. But these hormones, we have been using them for quite a long time now. Majorly there is not any major side effect with these hormones, and nowadays we have very sophisticated and I would say very highly purified compounds which are there, which we use in IVF cycle, which help us in retrieving and getting good amount and good quality of eggs without causing any major side effect in such cases. So if we talk about what other side effects can be there, you can have some bruise at the site of the injection, and sometimes there can be some bleeding inside which can appear as a bluish discoloration outside. So in that scenario, you can always connect to your doctor, and at home you can use cold fermentation, you can use an ice pack if you feel that some bleeding is occurring there at the site of the injection. So all those things, these are minor side effects which can be there due to these IVF injections, but majority of the times the kind of injections which we are using, there is hardly any major side effect. And the good part is that majority of them are given in the tummy, which you can self-administer, you can take them on your own, so that the major problem that used to occur earlier when the intramuscular injections were prescribed, that you had to take get it administered by a doctor, or you had to visit some clinic every day to get that injection, and those were usually administered in the buttocks, and those were intramuscular injections. Those are the kind of injections which used to cause major kind of side effects. But nowadays we have very highly purified and very efficacious drugs that we have nowadays, which help us in having the same results with just giving a very minimal amount, and so that you don't even feel. Nowadays we have the injections which are available in the form of pen, so that you can use it on your own. These are almost the same kind as are being used by diabetic people, which they administer them themselves daily before having any meal. So it is not that kind of a major side effect with these injections. Now next part comes after the egg retrieval is the embryo transfer. Many a times after embryo transfer, you are prescribed a whole list of medicines and many injections which are advised to be taken daily or weekly. Those are the kind of injections which can be a bit painful because those are progesterone injections, and many times oil-based injections are being advised. Sometimes we advise water-based also. So there can be pain while administering them because those are intramuscular injections which are given in your buttocks, and these are almost advised daily or alternate days depending upon your doctor's protocol. So the most important side effect I would say is with the injections which are usually prescribed after embryo transfer. Similarly, the other side effects can be again the same, bruises or abrasions if not given properly. So you can always opt for in-house nurse or a nursing staff who can visit your place and give you injections at your home, because when you are undergoing an IVF cycle, it is not advisable to travel daily for any injection after embryo transfer. So you should always either self-administer them if it is possible, or you should always try to have a facility of a nursing staff who can visit your place and give you injections, because exertion and daily traveling will have a negative effect on your chances of having pregnancy, or you may have some unnecessary bleeding or spotting also. So similarly, there are many types of injections which are advised in an IVF cycle depending upon the protocol, depending upon the kind of embryo transfer, fresh or frozen. But majority of them, they don't have any major side effect, and only slight minor side effects are definitely there. You have to deal with the mood swings, breast tenderness, bloating, nausea, but definitely if the result comes out to be positive at the end, all these side effects you don't feel at all. So I would say take care, best wishes for your IVF cycle. And if you have any other further query, you can always leave your questions in the comment section. You can you can connect to us on our website drvaishalisharma.com, and you can also subscribe to our channel for regular updates. You can share this video with the person who is in need about this information. And thank you. Take care.